A very good evening to you, our dear viewers, and welcome to your health show here on TV1 every Monday to Friday from 4 to 5 p.m. And of course, today is the end of the week, Friday, so we are going to be wrapping up with what we had in the week. But before we head there, let's start straight into our top stories for today. Now, the Ministry of Health warns pregnant women over the increased Ebola risk. Ministry of Health has warned pregnant women that they remain among the most vulnerable groups during these outbreaks, and they are urging expectant mothers to strictly follow the health rules and guidelines and report symptoms early to protect both themselves and the newborn babies and their unborn babies. And in a public health message shared during an ongoing Ebola surveillance efforts, the ministry emphasized that pregnancy increases the risks of severe complications when infected with this virus. And health experts explained that Ebola virus disease can cause serious illnesses in pregnant women, including heavy bleeding, miscarriage, premature labor, and increased risks of death for both mother and child if treatment is not taken in. Now, medical experts say that pregnant women infected with the Ebola virus often face a weakened immunity, making it harder for the body to fight against this virus effectively. And the Ministry of Health has therefore urged all expectant mothers to remain vigilant, avoid unnecessary physical contact, and maintain a proper hygiene, and immediately seek medical attention if they develop symptoms associated with Ebola. Now, common Ebola symptoms include a fever, severe headache, body weakness, vomiting, diarrhea, stomach pain, and unexpected bleeding. Health officials further warned against hiding symptoms or seeking treatment for unverified health facilities, saying that a delayed reporting increases the risk of transmission within the families and communities. Now, the ministry has also encouraged pregnant women attending antenatal care services to follow all infection prevention measures, including regular hand washing, avoiding handshakes and crowded places, and cooperating with the health screening teams. Uganda currently remains on high alert following the unreported Ebola cases linked to the ongoing Bundibujo Ebola outbreak in the eastern DRC. And health authorities have intensified screening at border points, strengthened surveillance in high-risk districts, and increased public sensitization campaigns to prevent the further spread of this disease. Now, medical experts continue to emphasize that early detection, isolation, and support treatment is significantly important, and it improves survival chances during the Ebola outbreaks. Now, the Ministry of Health says that pregnant women should remain calm, alert, follow official guidance, and seek immediate help whenever symptoms appear, stressing that early reporting can save both the mother and the baby. Now, moving on to our next story for today. Now, the government has called for stronger mental health support as the cases arise. The Ministry of Health has renewed calls for stronger mental health awareness and psychological support across communities as Uganda continues to witness rising cases of depression, anxiety, stress, and other mental health conditions. Now, speaking during an annual national mental health conference, the permanent secretary in the Ministry of Health, Dr. Diana Atwine, warned that many mental health challenges begin as small as emotional struggles but later develop into severe conditions when ignored. Doctor said emotional distress, untreated stress, and lack of support systems are increasingly affecting people's dignity, education, productivity, and overall quality of life. She emphasized that families and communities must become the first line of support in addressing mental health challenges because these conditions can worsen. We must not become sources of stress to our parents, partners, parents, relatives, and children, but instead become the sources of comfort, understanding, and hope, said Dr. Diana Atwine. Mental health experts at this conference highlighted the growing concern over the increase in cases of depression, substance abuse, anxiety disorders, and emotional breakdowns, especially among young people. Health officials say economic hardship, unemployment, domestic violence, academic pressure, social media influence, and drug abuse are among the major factors contributing to the worsening of the mental health conditions in the country at large. And according to the Ministry of Health, many Ugandans continue to suffer silently because of stigma, fear, misconceptions surrounding mental illnesses. Experts warn that untreated mental health conditions can lead to school dropouts, poor work performance, family conflicts, substance abuse, and even suicide. This conference also emphasized the need for expanding counseling services, strengthening community mental health programs, and increasing public health awareness campaigns aimed at breaking stigma around the mental illnesses. Now, government says that efforts are ongoing to improve mental health care services through recruitment of more specialists, expansion of treatment facilities, and implementation of the Mental Health Act of 2019. Health experts further urged Ugandans to openly talk about emotional struggles, seek professional help when necessary, and support people facing mental health challenges instead of isolating or judging them. And now the Ministry of Health says that promoting compassion, emotional support, and community understanding remains critical in building a healthier society and preventing mental health conditions from escalating into more and more serious illnesses. Now, moving on to our next story for today. Bilharzia fears grips Ginger Island as lake water turns deadly. Now, fear has gripped residents on several islands in Ginger district after increasing cases of bilharzia were linked to contaminated water sources and raising concerns among health officials and communities that depend on Lake Victoria for daily survival. Health workers said that the parasitic disease, commonly known as bilharzia, is spreading rapidly in island communities where residents rely directly on untreated water for drinking, bathing, washing, and fishing activities. According to the local leaders and medical teams, many residents, especially children and fishermen, are reporting symptoms associated within the disease, including stomach pain, diarrhea, blood in urine, skin rashes, and persistent fatigue. Health officials warn that prolonged exposure to these infected water bodies significantly increases the risk of transmission because the parasites enter the body through skin during contact with this contaminated water. Communities living on islands and landing sites around Lake Victoria are considered among the most vulnerable due to the limited access they have to clean water, poor sanitation, and inadequate health services. Residents said that this situation has become alarming as more people continue falling sick while safer water sources remain scarce. Some families reported have no alternative but to continue using this water lake despite of the fears of infection. And medical experts explain that bilharzia is caused by parasitic worms transmitted through freshwater snails that release infectious larvae into the water. Once inside the human body, the parasites can damage internal organs, including the liver, intestines, and bladder if left untreated. Health authorities are now calling for urgent interventions, including mass treatment campaigns, increased community sensitization, improved sanitation, and expanded access to clean water in affected island communities. Officials also urged to avoid swimming or bathing in the suspected contaminated water and encouraged early testing and treatment in the nearby facilities. Now, public health experts warn that without stronger prevention measures, bilharzia could continue affecting livelihoods, school attendance, and the overall health of vulnerable fishing communities around Lake Victoria. Now, moving on to our international story for today. WHO experts recommend candidate vaccines and treatments for the Bundibugyo strain, which is called Ebola. Now, the World Health Organization has announced a new recommendations on the possible vaccines and treatments for the Bundibugyo strain of Ebola currently affecting the Democratic Republic of Congo and Uganda. The recommendations follow a series of emergency meetings convened by WHO, bringing together international experts, scientists, and vaccine advisory groups to assess promising medical options for preventing and treating the Bundibugyo Ebola virus disease. Now, health experts said that there is currently no approved vaccine for specific treatment, specifically licensed for the Bundibugyo strain of Ebola, making the ongoing outbreak particularly challenging. However, the WHO experts identified several promising candidate medicines and vaccines that could now be prioritized for medical trials in the affected communities and countries. For treatment of infected patients, experts recommend prioritizing 3 potential therapies, including the monoclonal antibiotics and marivimab, as well as antiviral drugs. And also, specialists also recommend studying combination therapy using monoclonal antibiotics together with remdesivir to assess whether the approach improves survival among Ebola patients. For prevention, experts identified an antiviral medicine known as Obelisivir as a possible option for post-exposure protection among people who have been in contact with the confirmed Ebola patients. And health experts explained that the medicine could potentially help prevent exposed individuals from developing Ebola disease if administered early enough after exposure. Now, WHO's experts are also reviewed candidate vaccines currently under development against the Bundibugyo strain. The most promising vaccine identified was the single-dose Bundibugyo vaccine being developed by the International AIDS Vaccine Initiative. However, scientists say that the vaccine must still require between 7 to 9 months before it becomes ready for large clinical trials. Another vaccine that has been developed by Oxford University together with the Serum Institute of India could potentially become available for clinical testing within 2 to 3 months, depending on additional laboratory data. And experts further reviewed the Elvivo, the only licensed Ebola vaccine currently available globally. However, WHO clarified that this vaccine is destined for Zaire strain of Ebola, and there is still limited evidence showing whether it offers protection against the Bundibugyo strain. So the organization therefore advised that using this vaccine should be used within carefully controlled research studies during the current outbreak. And WHO says that all vaccines and treatments identified must only be used through ethical clinical trials supervised by the health officials and specific experts to ensure safety and effectiveness. Meanwhile, WHO emphasized that the immediate priority remains strengthening traditional Ebola control measures, including rapid testing, surveillance, contact tracing, and patient isolation, infection prevention and community engagement, and also safe burial processes. Now, the Bundibugyo Ebola outbreak has already triggered international concern following cases confirmed in Uganda linked to the larger outbreak in the Democratic Republic of Congo. Now, moving on to our last story for today. There has been a message by the WHO's Director General to the people of Democratic Republic of Congo and Uganda. Now, the World Health Organization Director General Dr. Tedros has issued an emotional message to the people of DRC as the deadly Bundibugyo outbreak continues to spread across the eastern DRC and the neighboring Uganda. In a heartfelt address directed especially to the people of Ituri province, Dr. Tedros reassured affected communities that they are not alone, recalling his personal experiences during the previous Ebola outbreaks in the region, where he visited North Kivu more than 14 times between the year 2018 and 2020. Dr. Tedros, who was given the local name Paluku during the earlier Ebola response missions, described the courage of health workers, community leaders, and families who continued fighting for the disease despite conflict, displacement, and insecurity. He warned that the current outbreak is particularly dangerous because it involves the rare Bundibojo strain of Ebola, for which there is currently no approved vaccine or specific treatment. And according to the WHO, Ituri province remains the epicenter of the outbreak, accounting for more than 90% of the reported infections, while additional cases have also been detected in the North Kivu and South Kivu and also in Uganda. The WHO chief acknowledged the fear, exhaustion, and hardship of these communities that they are facing, especially amid the ongoing insecurity and humanitarian challenges, but urged residents to continue cooperating with the health teams, report systems early, and support Ebola prevention measures. He emphasized that although no approved treatment currently exists for this strain, early supportive care, rapid isolation, and contact tracing, community awareness, and safe barriers remain critical in saving lives and also containing the transmission. He confirmed that he will personally travel to Bunia in the eastern DRC to support the response efforts and engage directly with the affected communities and leaders. He concluded by reminding the people of DRC and the country and that the country has successfully overcome 16 previous Ebola outbreaks and expressed confidence that through unity, trust, and resilience, this outbreak can be defeated. Now, to our dear viewer, those are our stories for today. We are going to take a look at a video where the WHO's Director General Tedros has briefed the media on the ongoing Ebola outbreak in the eastern DRC, where health authorities continue to intensify response efforts amid the rising infections and the regional concern. Let's take a look at that video.
Let me introduce the panel first, before we go into introductory remarks. Of course, first and foremost, Dr. Tedros Adhanom Ghebreyesus, Director General. Next to him is Dr. Mohamed Yaqub Janabi, WHO Regional Director for Africa. Very happy to have him here. Then we have Dr. Chikwe Ihekweazu. He's the Executive Director for WHO's Health Emergencies Program. Next to him is Dr. Abdi Mahmoud, Director of Health Emergency Alert and Response Operations. On the other side, we have Dr. Sylvie Briand, WHO Chief Scientist, and next to her is Dr. Maria van Kerkhove, Interim Director of WHO's Department of Pandemic Management. We have a couple of other colleagues online. One to mention is we have Dr. Ann Ansia available. She's the WHO representative to the Democratic Republic of the Congo. She's currently in the field, so we hope we could get her connected in case, but we'll see other colleagues in case we get to them. With this, enough of me, and over to Dr. Tedros.
Thank you, Christian. Good afternoon to everyone in the room, and good morning, good afternoon, and good evening to those joining us online. The Ebola outbreak in the Democratic Republic of the Congo is spreading rapidly. Previously, WHO assessed the risk as high at the national and regional levels and low at global levels. We're now revising our risk assessment to very high at the national level, high at the regional level, and low at global level. So far, 82 cases have been confirmed in DRC, with 7 confirmed deaths. But we know the epidemic in DRC is much larger. There are now almost 750 suspected cases and 177 suspected deaths. The situation in Uganda is stable. with 2 cases confirmed in people who traveled from DRC, with 1 death. The measures taken in Uganda, including intense contact tracing and cancelling the Martyrs' Day commemoration, appear to have been effective in preventing the further spread of the virus. An American national who was working in DRC has also been confirmed positive and transferred to Germany for care. We're also aware of reports today about another American national who is a high-risk contact who has been transferred to the Czech Republic. The governments of DRC and Uganda are leading the response with support from WHO and partners. In addition to our national staff in DRC, so far we have deployed 22 international staff to the field, including some of our most experienced people. And we have released $3.9 million from the contingency fund for emergencies. We're also in touch with UN humanitarian chief Tom Fletcher, and I thank him for allocating $60 million to the response. On the ground, we're supporting national authorities with every pillar of the response, including contact tracing, establishing treatment centers, risk communication, and community engagement, and more. Together with the Africa CDC, WHO is also establishing a continental incident management support team. In the coming days, we will publish a multi-agency strategic preparedness and response plan, SPRP, aligned with the national plans of both DRC and Uganda and with our partners. As you
identify for the treatment of patients?
Thanks for that question. I just wanted to tell people how the